All
right, we're going to cut away from that to take you to St. John's now, where we're getting an update on COVID-19 from the Premier.
To keep you informed and to keep everyone in Newfoundland and Labrador safe. In a few moments, Drs. Fitzgerald and Haggie will update you first with the news that the entire province will be moving to Alert Level 3 later this evening, and then share news on the continuing arrival and rollout of boosters and ramping up of mass vaccination clinics. Our team is working incredibly hard to get those doses out where they are needed as soon as possible when they land in the province. So please continue to be patient and be kind. Your kindness now to everyone you encounter is more important than ever before in this pandemic. Please know that none of us on this panel want to be here right before the Christmas season. And we know the public health measures are tough. And the rising threat of Omicron is disheartening for all of us, especially after all we've been through and during this special time of year. I know we are again asking people to dig a little deeper and find the energy and the fortitude to help us all face what we are up against. But I feel like we are already doing it. I see that in the overwhelming number of inquiries regarding those booster shots. Just days away from the holiday break, I know the timing couldn't be worse. And in the spirit of the season, health is one of the best things you can all wish for. So let's embrace that. And let's do our part. Please listen, remind, and reinforce those public health measures. Keep distance, mask up, wash your hands, and keep your contacts low. Stay at home if you feel sick. Get tested if you have a symptom. And please arrange to get your booster shot. I know that will require some patience, but trust us as we continue to ramp up and accelerate the delivery of those vaccines. Your actions today will certainly make incredible impact tomorrow. On behalf of all of Newfoundlanders and Labradorians, let me provide a direct message to our frontline healthcare providers. We know you've been through one heck of a year, and you're exhausted, tired, fatigued. We know that you're doing your best in these trying times, and please know that we are all here to support you and cheer you on as you look after all of us. So please keep up the hard work. With that, I'll turn things now over to Dr. Fitzgerald for an update on today's numbers and new measures that are being implemented. Dr. Fitzgerald.
Thank you, Premier. Thank you all for joining us today. Since the last media advisory yesterday, we have 60 new confirmed cases of COVID-19 in the province, all of which are under investigation at this time. 37 cases are in Eastern Health, 10 are in Central Health, 12 are in Western Health, and there's one case in Labrador-Grenville Health. There have been 12 new recoveries, leaving 223 active cases in the province. No one is hospitalized as a result of COVID-19, and 3,458 tests were completed since yesterday, with over 365,000 tests completed to date. We now have active outbreaks in Western, Central, and Eastern Health, and our active case count has jumped from 30 to 223 in 1 week. Thankfully, right now, we have no hospitalizations due to COVID, but we are carefully monitoring what is happening in other jurisdictions that are further ahead in their Omicron outbreaks in an effort to gauge what to expect in terms of disease severity. We are cautiously optimistic, but it is still too early to draw any conclusions. Our fear is that if we start to see severe illness, it will overwhelm our healthcare system, which is already stretched. And we are pulling healthcare staff from other areas to work on COVID response, and we cannot risk a surge in hospitalizations. If our hospital capacity is taken up with COVID-related illnesses, that means we have less capacity to care for those with non-COVID, urgent, and emergent health issues. Our daily case count has remained steady over the past week. However, we do anticipate it will rise given how infectious Omicron is. How rapidly and to what extent our case counts rise really depends on how careful we are during this critical period. It gives me no joy to say that we have made the difficult decision to move to the entire province into Alert Level 3, effective midnight tonight. Under Alert Level 3, weddings, funerals, burials, religious and cultural ceremonies are limited to 100 people or 50% of venue capacity, whichever is less. Public visitations are permitted with one household bubble visiting at a time, and wakes are prohibited. Performance spaces, cinemas, and bingo halls are closed. Fitness facilities, swimming pools, arenas, and dance studios are permitted to open with a maximum capacity of 100 people or 50% capacity per room or ice surface, whichever is less. Physical distancing between households must be maintained. Restaurants are open at 50% capacity with physical distancing. Bars and lounges are closed. Amateur sport and recreation activities are limited to team practice and training only. Competition and training with other teams, even within the association, is not permitted. And informal gatherings, such as those in the home, are limited to your household's steady 20. We ask every household to have no more than 20 close, consistent contacts. Anyone that is medically vulnerable and older individuals should be extra cautious, especially those that have not had their COVID-19 booster. If you fall in this category, limit your contacts to your close friends and family that you usually spend time with. With regard to travel within the province, we recognize that this is an important time for families to be together, and we know that students will be returning to their home communities, and you may have loved ones that need support during the holidays. We also recognize that some families may travel to their cabins or cottages to other areas of the province over the holidays to celebrate Christmas. Travel for these reasons is acceptable, but please stop and consider if your travel is essential or necessary. If you must travel, please be cautious and keep your contacts low. You should not be traveling to another area of the province to have a party with people who are not in your close, consistent 20. The more movement of people we have within the province, the more spread of the virus we will see eventually. And we strongly recommend that employers support employees to work from home where possible. If we can get everyone's support in adhering to these measures, it will help to alleviate the pressure on our healthcare system and preserve capacity to deliver vaccinations, respond to COVID outbreaks, and treat all non-COVID-19 health concerns. Our public health teams are very tired. They've been really working tirelessly, even during periods of low prevalence of COVID, and we really need the whole public to support our teams right now and to try to reduce their contacts. It's the most important thing that you can do, along with staying home if you're sick. The last thing we want is for people to think the work we have put into the last 2 years is all in vain. We benefited from a largely favorable epidemiology and very few restrictions compared to other jurisdictions. But most importantly, we saved lives. Today, we need to face things as they are, not as we want them to be. We will reassess where we are on January 10th to determine if we can change the alert level. I know there is significant demand for booster shots right now. Please have patience while pharmacies, clinics, and regional health authorities schedule appointments. We will have enough supply for everyone who wants a booster. Please also remember that it takes 14 days for your booster to give you maximum protection. Please do not schedule a booster dose before you have reached at least 22 weeks past the completion of your primary vaccine series. So for most of us, that's after your second dose. Those administering the vaccine are not permitted to administer it before you reach 22 weeks. In the weeks ahead, more people will receive a call or a letter from public health to advise that they have been in close contact with a positive case. These are what we refer to as high-risk contacts because the nature of the exposure means they have a higher risk of getting COVID-19. For example, if you attended an informal gathering in a home where there was no masks worn and no distancing, you would be a high-risk contact of a case there. High-risk contacts have more stringent testing and isolation requirements. If you found out that you may have been exposed to COVID-19 through a public exposure notification, or if you were contacted by a business to let you know that you may have been in the same place as someone that tested positive, you would not be considered a high-risk contact, and those individuals should book a test, but are not required to isolate unless symptomatic. We have a self-isolation tool online that will help you determine your requirements based on how you were notified. Please remember that 811 cannot tell you self-isolation requirements. Public health will give you specific guidance if you are a high-risk contact. If you are uncertain what to do, use the self-isolation tool. We need to preserve 811 capacity for those that need health advice from a registered nurse. We issue public exposure notifications for settings where the risk is higher, for example, bars and restaurants, where people would remove their masks to eat or drink. But make no mistake, COVID can be anywhere. Even if you have not been exposed to COVID-19, if you have one symptom, you should assume it is COVID, stay home, and book a test. If your test is negative, stay home and away from others until your symptoms resolve. This is our last media availability before Christmas, and we have heard it said many times that COVID-19 does not take a holiday. That means public health will be working throughout Christmas on swabbing, testing, case investigation, and contact tracing. So if you have interactions with public health staff, please be kind and patient with these people that are working through the holidays to help protect you and your loved ones. To our staff in the regional health authorities and here in the department working quite literally around the clock on COVID response, I want you to know that I have the utmost gratitude and respect for your dedication. We could not have come so far and fared so well without all of you. To everyone across our province, this may be another different Christmas, but I hope that you and your loved ones can find peace and happiness. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I certainly echo those comments that all the hard work has not been in vain. We do have a good vaccination rate, and that we just need to act now. It's too late to act 2 weeks or 3 weeks from now when things may have gotten out of control. So with that, I will turn things over to Dr. Haggie for some brief comments. Minister?
Thank you very much, Premier, and I'll start where you left off. I spoke with the CEOs of the regional health authorities over the course of the last 12, 14 hours, and amongst other topics, stressed that we were in a relatively good place compared with other jurisdictions to face what's coming. Given the rise in case numbers, the change in alert level for the whole of the province is a sensible, proactive measure. Given the time of the year and the fact we're all now kind of in the same boat, the comments that Dr. Fitzgerald makes about travel are especially helpful. It balances family reunification and public health in a way we probably would not have been able to do had we not done as well through the efforts of public health and yourselves over the course of the last 2 years. I have, through the CEOs, extended my own pride and thanks to the public health and frontline healthcare workers who have stepped up repeatedly over the course of the last little while. In terms of other changes, Dr. Fitzgerald referenced the rollout of the boosters. We have 214,000 booster doses of Moderna in the province and available. And our challenge now is simply painting clinics and appointments faster than people are booking them. It's great to see that demand, but it is a challenge to rise to that. The regional health authorities have very clear direction to pivot, to focus on booster administration and to get these into arms. Pharmacies across the province who participate in the COVID vaccination submit their requests for a volume, and these are being met and will continue to be met, and there is margin if they need more. So again, they are another route. Equally, we have a number of physicians who are giving COVID shots and COVID boosters, and they may be yet a third route. Given the comments that Dr. Fitzgerald's made, I just want about assessment and online services. The place to go for information, good, high-quality, accurate information, is the website. 811 is there solely for those individuals who do not have internet access, and 911 is not at all appropriate for these kind of questions. Those are for emergencies only, and unfortunately we have seen people calling those inappropriate, and I would encourage you to use the website. From the point of view of government employees, the deputy ministers and executives in Crown corporations are being told to, wherever possible, allow their employees to work from home if their job can be satisfactorily done from home. If not, then they will come into work. Along with the other measures that were announced, this work from home policy will be revisited on January the 10th. The details for the employees concerned is being worked on today and will be rolled out over the course of the next 24 hours or so. So I think with that, again, I would pause, wish people a happy holiday, Merry Christmas, if that's your tradition, and stay safe. Thank you very much, Premier.